And I think that we have to put these messages across to riders and trainers that early recognition of these problems is key to successful long-term management. Alternatively, we have to put across the message that we need to change training methods. We need to emphasize the importance of correct posture, core stability and movement patterns in order to enable a horse to live with its underlying problems. And we also, as veterinarians, need to determine what are the aspirations of the owner for the horse, their budget, and their capabilities, because a problem seen in one horse may be readily managed by one rider, but not readily managed by a rider of either different skill or different size or with some underlying physical problems. In my view, the keys to successful management are accurate diagnosis or diagnoses. So we need to recognize the lame limb or limbs, determine the source of pain in the lame limbs, which is ideally done by the use of diagnostic anesthesia, and then to identify the likely cause of the pain through the use of diagnostic imaging, which will then allow targeted treatment of the primary problems. We will also need to address the secondary problems, such as muscle development, movement patterns, and posture. So in the horse on the right, we can see that the horse is standing in an abnormal posture. The forelimbs are camped underneath the body rather than in alignment of the yellow line dropped from the cranial aspect of the elbow to the ground. The hind limbs are camped out behind the horse, so they are behind a line which is tangential to the tuberosii and perpendicular to the ground. The lumbar region is very poorly muscled, and the withers region is dropped. And these are the types of secondary changes we see in a horse which has had a chronic lameness. We also need to determine any possible predisposing factors and address these. And these would include the footing on which the horse regularly works, the training methods that are employed, saddle fit for both the horse and the rider's position, and very importantly, the way in which the horse is trimmed and shod, and the frequency with which the feet are attended to. The preliminary assessment is going to include acquisition of an accurate history and an overall impression of the horse's posture, musculature, and the quality of trimming and shoeing. We can see a rather poorly balanced foot on the right. We need to identify which are the lame limbs, bearing in mind that the owner is often wrong and that lameness is rarely related to the shoulder. So in order to determine which are the lame limbs, we're going to need to appraise the horse moving in hand, on the lunge on both soft and firm surfaces, and if appropriate, also during ridden exercise. Some additional information may be acquired using objective gait analysis, but I think it is hugely important that undue reliance is not placed on objective gait analysis without relating the results to both the history and to careful visual assessment, because it does have the potential at times to be misleading. It does, however, provide a baseline assessment of the lameness with which we can objectively compare the results after diagnostic anesthesia. There need to be discussions with the owner. They need to be appraised that the horse needs to be investigated to get the correct answers. And this essentially involves diagnostic anesthesia, radiography and ultrasonography, with or without more advanced imaging techniques such as computed tomography or magnetic resonance imaging. We need to outline the costs involved, the costs for our professional time and skill, the costs of consumables, and the costs of imaging. Many owners want answers, definitive answers.